Have you ever stopped to think about how wonderfully interconnected our bodies truly are? We often visit different specialists for different parts: the cardiologist for our heart, the optometrist for our eyes, perhaps a podiatrist for our feet, and of course, the dentist for our teeth and gums. It can sometimes feel like we're treating separate systems. But what if I told you that what happens in your mouth doesn't necessarily stay in your mouth? What if the health of your teeth and gums has a surprisingly direct and potentially serious impact on one of the most vital organs in your body, your heart? It might sound a little far-fetched at first glance. After all, what could a bit of gum soreness or a sensitive tooth possibly have to do with something as complex and critical as cardiovascular health? Yet, a growing body of scientific evidence is painting a very clear picture. There is a significant and fascinating link between oral health and heart disease. Understanding this connection is becoming increasingly important, especially as we navigate our later years when both conditions tend to become more prevalent. Think about it. For many of us, reaching our senior years brings a heightened awareness of our health. We become more attuned to our bodies, more diligent, perhaps, about checkups, medications, and lifestyle choices aimed at protecting our heart, managing blood pressure, or keeping cholesterol in check. We read articles, we talk to our doctors, we try to eat well and stay active. Heart health is often, quite rightly, front and center in our minds. It governs so much of our vitality, our ability to enjoy life, to spend time with loved ones, to remain independent. We understand the stakes are high. But amidst all this focus on the heart, how much thought do we typically give to our oral hygiene beyond the basics of brushing and maybe flossing? For many, a dental checkup might feel like a less urgent priority compared to a cardiac follow-up. A little bleeding when brushing might be dismissed as brushing too hard, or a bit of gum recession might be seen as just another inevitable sign of aging. We might worry more about a potential cavity or the aesthetics of our smile than about the deeper implications of what's happening beneath the gum line. It's completely understandable. We juggle various health concerns, appointments, and advice. Sometimes, the sheer volume of information can feel overwhelming. And let's be honest, visits to the dentist aren't always something we look forward to. There can be anxiety, perhaps memories of less comfortable experiences from years past, or concerns about the cost. So it's easy to see how oral health might sometimes slip down the priority list, especially if there isn't any immediate significant pain. We might think, if it's not hurting badly, it can probably wait. Or perhaps we assume that as long as we're brushing twice a day, we're doing enough. The idea that bacteria festering in our gums could somehow embark on a journey through our bloodstream and contribute to the narrowing of arteries around our heart seems almost like science fiction. But the reality is, our mouth is a gateway to the rest of our body in more ways than one. It's teeming with bacteria, hundreds of different species, in fact. Most are harmless, and some are even beneficial. However, when our oral hygiene isn't optimal, certain harmful bacteria can multiply unchecked. This is particularly true when plaque, that sticky film of bacteria and food debris, is allowed to build up along the gum line. If this plaque isn't regularly removed through effective brushing and flossing, it hardens into tartar, which irritates the gums, causing them to become inflamed. This initial stage of gum disease is called gingivitis. You might notice symptoms like red, swollen, or tender gums, or perhaps bleeding when you brush or floss. It might seem minor, just a localized irritation. But if left untreated, gingivitis can progress to a more serious form of gum disease called periodontitis. Periodontitis is where the real trouble can begin, not just for your mouth, but potentially for your heart as well. In periodontitis, the inflammation becomes chronic and more severe. The gums pull away from the teeth, creating pockets where even more bacteria can hide and thrive. These bacteria release toxins, and the body's immune system ramps up its efforts to fight the infection. This chronic inflammatory response starts to break down the bone and connective tissue that hold teeth in place. Teeth can become loose and may eventually need to be extracted. This process itself is damaging enough to oral health, affecting our ability to chew comfortably, potentially impacting nutrition, and even affecting our confidence. But the effects don't stop at the jawline. This is where the link to heart disease becomes clearer. Think of those inflamed, bleeding gums and the deep pockets formed by periodontitis as open doors. The bacteria breeding in these pockets, along with the inflammatory substances produced by the body's immune response, can enter the bloodstream. Once in circulation, these bacteria and inflammatory markers can travel throughout the body. They can potentially contribute to inflammation in the walls of blood vessels, including the coronary arteries that supply blood to the heart. Inflammation is a key driver in the development and progression of atherosclerosis, the buildup of fatty plaques in the arteries. These plaques can narrow the arteries, restricting blood flow, and they can also become unstable and rupture, leading to blood clots that can trigger a heart attack or stroke. It's a complex biological cascade, but the underlying principle is becoming increasingly recognized. Chronic inflammation, originating from conditions like severe gum disease, can have systemic effects that contribute to cardiovascular problems. So, that bleeding you might notice when you brush? While it could occasionally be from brushing too vigorously, more often than not, it's an early sign of gum inflammation. The very inflammation that could potentially set the stage for wider health issues down the line if ignored. It's not about causing alarm, but about fostering understanding and empowerment. Knowing about this connection allows us to reevaluate the importance we place on our oral health routines. It reframes a visit to the dentist not just as maintenance for our teeth, but as a crucial part of our overall preventive health strategy, especially concerning our heart. As we age, our immune systems may not function as robustly as they once did, and we might be managing other chronic conditions like diabetes, which itself can increase the risk for both gum disease and heart disease, creating a complex interplay. Therefore, paying close attention to this mouth-heart connection becomes even more pertinent. In the sections that follow, we'll delve deeper into the specific ways oral health issues, particularly gum disease, are thought to influence heart health. We'll explore the science behind this link in more detail, looking at the mechanisms researchers believe are at play. We'll discuss the specific signs and symptoms of gum disease you should be aware of, beyond just bleeding gums. And most importantly, we'll focus on the practical, actionable steps you can take every single day, and through regular professional care to maintain excellent oral hygiene, thereby potentially reducing your risk for heart-related complications. This isn't about adding another worry to your plate. It's about equipping you with knowledge that can help you take comprehensive, holistic care of your well-being, ensuring that your smile stays healthy and your heart stays strong for years to come. Let's explore this vital connection together. In our previous discussion, we opened the door to a connection that might have seemed surprising initially: the link between the health of your mouth and the health of your heart. We touched upon how inflammation and bacteria originating from gum disease, particularly the more advanced stage known as periodontitis, might not remain localized issues, but could potentially influence cardiovascular health systemically. Now, let's delve deeper into how scientists and medical professionals believe this connection actually works. Understanding these pathways can reinforce why tending to your oral hygiene is such a fundamentally important aspect of your overall well-being, especially concerning your heart. One of the primary mechanisms researchers focus on is inflammation. We talked about how untreated plaque buildup leads to gingivitis and then potentially periodontitis, characterized by chronic inflammation of the gums and the supporting structures of the teeth. Think of this chronic inflammation like a smoldering fire in your mouth. While it might seem contained, the smoke, in this case, inflammatory chemicals and signals, doesn't necessarily stay put. Your body's immune system, constantly trying to fight the persistent bacterial infection in your gums, releases various substances into the bloodstream. These are known as inflammatory markers or mediators. One such marker you might have heard of is C-reactive protein, or CRP. Elevated levels of CRP in the blood are widely recognized as a general indicator of inflammation somewhere in the body. And importantly, high CRP levels are also considered a risk factor for cardiovascular disease. So, how does the smoke from the fire in your gums contribute to problems in your arteries? When these inflammatory substances circulate throughout your body via the bloodstream, they can contribute to inflammation within the walls of your blood vessels. This vessel inflammation is a critical component in the development of atherosclerosis, which, as we know, is the gradual buildup of fatty plaques, atheromas, inside your arteries. It's not just about cholesterol passively sticking to artery walls. Inflammation actively participates in this process. It can damage the delicate inner lining of the blood vessels, the endothelium, making it easier for cholesterol and other substances to accumulate. Furthermore, inflammation can make the plaques that do form less stable and more prone to rupturing. If a plaque ruptures, the body responds by forming a blood clot at the site. If this clot is large enough, or if it breaks off and travels, it can block blood flow to the heart, causing a heart attack, or to the brain, causing a stroke. Therefore, the chronic low-grade systemic inflammation triggered by severe gum disease can add fuel to the fire of atherosclerosis, potentially accelerating the process or increasing the risk of a dangerous cardiovascular event. Imagine someone, let's call him Arthur. Arthur is in his early 70s, generally watches his diet and takes medication for slightly high blood pressure. He's diligent about his heart health checkups. However, he's always found flossing cumbersome and notices his gums bleed easily when he brushes, which he dismisses as normal for his age or perhaps due to his blood pressure medication. He hasn't seen a dentist in a couple of years, thinking his teeth feel fine. Unbeknownst to Arthur, he has developed moderate periodontitis. The persistent inflammation in his gums is quietly contributing to elevated inflammatory markers circulating in his system. While his cardiologist monitors his blood pressure and cholesterol, this underlying systemic inflammation, partially driven by his oral health, might be subtly increasing his overall cardiovascular risk without him or even his doctor realizing the source. This hypothetical scenario highlights how easily the oral health component can be overlooked, yet how potentially significant its contribution to systemic inflammation, a known cardiac risk factor, might be. Beyond the pathway of inflammation, there's another avenue researchers are actively investigating: the direct role of oral bacteria themselves. As we established, the mouth harbors a vast ecosystem of bacteria. In periodontitis, the deep pockets that form between the gums and teeth become breeding grounds for specific types of harmful or pathogenic bacteria. When gums are inflamed and bleed easily, which is common in gum disease, it creates an entry point for these bacteria to escape the mouth and enter the bloodstream. This event, known as bacteremia, can happen even during routine activities like chewing or brushing teeth, especially if significant gum disease is present. Once these oral bacteria are circulating in the blood, where do they go? Studies have found evidence of the specific types of bacteria commonly associated with periodontitis, like Porphyromonas gingivalis, within the atherosclerotic plaques removed from the arteries of patients with heart disease. This finding raises the possibility that these bacteria might play a more direct role in plaque formation or progression. Some theories suggest that these bacteria, upon reaching the blood vessels, could directly damage the vessel lining, promote inflammation locally within the vessel wall, or even contribute to the mechanisms involved in blood clot formation. Think of it like tiny invaders traveling through your circulatory system and potentially setting up camp or causing damage far from their original home in your mouth. While the presence of these bacteria in plaques is compelling evidence of a link, it's important to maintain perspective. Research is ongoing to determine conclusively whether these bacteria are active participants causing the damage, or if they are simply innocent bystanders that tend to accumulate in areas already affected by inflammation and plaque buildup. Proving direct causation in complex biological systems is challenging, but the association is strong enough to warrant serious attention. Now, it's also crucial to acknowledge a third important factor: shared risk factors. It's rarely a simple one-to-one cause and effect relationship in health. Often, different conditions share common underlying risk factors that increase the likelihood of developing both problems. This is certainly true for gum disease and heart disease. Several lifestyle factors and health conditions are known to increase the risk for both. Smoking. This is perhaps the most significant shared risk factor. Smoking damages blood vessels and promotes atherosclerosis, directly increasing heart disease risk. Simultaneously, smoking impairs blood flow to the gums, compromises the immune response in the mouth, and makes individuals much more susceptible to developing severe gum disease. Quitting smoking offers profound benefits for both cardiovascular and oral health. Diabetes. Poorly controlled diabetes significantly increases the risk for both heart disease due to effects on blood vessels and cholesterol levels, and periodontitis. High blood sugar levels can weaken the body's ability to fight infection, making gum disease more likely and potentially more severe. Conversely, severe gum disease, with its associated inflammation, can actually make it harder to control blood sugar levels, creating a detrimental feedback loop. Managing diabetes effectively is therefore critical for protecting both your heart and your gums. Age. Unfortunately, the risk for both conditions generally increases as we get older. Biological changes associated with aging can affect both the cardiovascular system and oral tissues. Diet. A diet high in sugar and processed carbohydrates can contribute to plaque formation in the mouth and also negatively impact heart health through effects on weight, blood sugar, and cholesterol. Conversely, a heart-healthy diet rich in fruits, vegetables, and whole grains tends to be beneficial for oral health as well. Stress. Chronic stress can contribute to inflammation throughout the body and may also lead to neglect of self-care routines, including oral hygiene, potentially impacting both heart and gum health. Understanding these shared risk factors is important because it tells us that lifestyle choices aimed at protecting your heart, like not smoking, managing diabetes, eating well, and managing stress, will very likely benefit your oral health too, and vice versa. It reinforces the idea of holistic health. Taking care of one part of your system often has positive ripple effects elsewhere. Consider someone like Margaret, who decided to quit smoking in her late 60s primarily for her heart health. She also started being more diligent about managing her type 2 diabetes. Over the following year, not only did her doctor note improvements in her cardiovascular markers, but her dental hygienist also commented on how much healthier her gums looked, with significantly less bleeding and inflammation than before. Her actions, driven by one concern, yielded benefits across multiple areas. Given these potential pathways, inflammation, direct bacterial effects, and shared risk factors, it becomes clear why paying attention to the signs of gum disease is so vital. But what exactly should you be looking for? It's often more subtle than a raging toothache. Be vigilant for these signs and symptoms of gum disease, gums that bleed easily, especially during or after brushing or flossing. This is often one of the earliest and most common signs. Don't ignore it. Red, swollen, or tender gums. Healthy gums are typically pink and firm. Inflammation makes them look angry and feel sensitive. Gums pulling away from the teeth, receding gums. This can make your teeth appear longer than they used to. It indicates loss of attachment and potential bone loss underneath. Persistent bad breath, halitosis, or a bad taste in your mouth. This can be caused by the bacteria and decaying food particles trapped in gum pockets, or by the infection itself. Formation of deep pockets between teeth and gums. Your dentist or hygienist measures these pockets. Deepening pockets are a key sign of periodontitis progression. Loose or separating teeth. This is a later sign, indicating significant damage to the supporting bone and tissues. Changes in the way your teeth fit together when you bite. This can happen if teeth shift due to bone loss. Pus visible between your teeth and gums. This is a clear sign of infection. One of the most crucial things to remember is that gum disease, especially in its early stages, gingivitis, and even into moderate periodontitis, is often painless. You might not feel any discomfort until the condition is quite advanced. This is why relying solely on pain as an indicator is risky. Regular dental checkups, even when things feel fine, are essential for catching gum disease early when it's most easily treatable and reversible, long before it has a chance to potentially impact your wider health, including your heart. So, we've explored the intricate ways your oral health, particularly the state of your gums, is interwoven with the health of your cardiovascular system. We've seen how inflammation can travel, how bacteria might play a direct role, and how shared risk factors tie these two seemingly separate areas together. Recognizing the subtle, often painless signs of gum disease is the first step towards taking control. In our final chapter, we will focus squarely on what you can do, the practical strategies, daily habits, and professional care that can help you maintain a healthy mouth and, in doing so, contribute positively to protecting your precious heart. Over our journey together in the previous chapters, we've explored a truly vital, yet sometimes overlooked, aspect of our health: the profound connection between what happens inside our mouths and the well-being of our hearts. We started by acknowledging that perhaps we haven't always thought of oral health as being directly linked to something as critical as cardiovascular disease. We tend to compartmentalize, visiting different specialists for different parts of our wonderfully complex bodies. But we've seen compelling evidence suggesting that the health of your gums, in particular, is far from being just a local issue. It sends ripples, sometimes significant ones, throughout your entire system. Let's take a moment to revisit the key insights we uncovered. We learned that the journey often begins with plaque, that sticky film of bacteria, building up along the gum line. If not diligently removed, this triggers inflammation, starting as gingivitis, red, swollen, bleeding gums, and potentially progressing to the more serious condition of periodontitis. This advanced stage involves chronic inflammation, the formation of deep pockets between teeth and gums, and eventually, damage to the bone supporting the teeth. Crucially, we discussed how this chronic inflammation doesn't necessarily stay confined to the mouth. The inflammatory chemicals and messengers produced by your body's ongoing fight against the gum infection can enter your bloodstream. Think back to that image of a smoldering fire. The smoke, those inflammatory markers like C-reactive protein, travels systemically. This systemic inflammation is a known accomplice in the development and progression of atherosclerosis, the dangerous hardening and narrowing of arteries due to plaque buildup. It can make artery walls stickier for cholesterol and other deposits, and perhaps even more concerningly, it can make existing plaques unstable and prone to rupture, potentially leading to heart attacks or strokes. So, the inflammation originating in your gums can indeed contribute to the inflammatory processes affecting your heart and blood vessels. Beyond inflammation, we also touched upon the possibility of a more direct bacterial invasion. The very bacteria that thrive in those infected gum pockets, culprits like Porphyromonas gingivalis, can gain entry into your circulation, especially when gums are bleeding. This phenomenon, called bacteremia, means these oral microbes are traveling through your body. Researchers have discovered the presence of these specific bacteria within the atherosclerotic plaques themselves, suggesting they might be more than just passive observers. While the precise nature of their role, whether they actively cause damage, promote clotting, or simply find a welcoming environment in already inflamed vessels, is still being intensely studied. Their presence alone underscores a direct biological link between severe gum disease and cardiovascular pathology. Furthermore, we recognize the importance of shared risk factors. It became clear that certain lifestyle choices and health conditions pave the way for both gum disease and heart disease. Smoking stands out as a major villain, damaging both blood vessels and gum tissues. Poorly controlled diabetes creates a challenging environment for both systems, often creating a vicious cycle where gum disease can worsen blood sugar control, and high blood sugar hampers the fight against gum infection. Increasing age naturally elevates the risk for both conditions, and factors like a high-sugar diet and chronic stress can also play detrimental roles. Understanding these shared risks is empowering because it highlights how positive lifestyle changes, quitting smoking, managing diabetes effectively, adopting a heart-healthy and gum-friendly diet, finding healthy ways to cope with stress, can provide double or even triple benefits, protecting your heart, your gums, and your overall health simultaneously. And finally, we highlighted the key signs of gum disease to watch for: gums that bleed easily when you brush or floss, redness and swelling, receding gums that make teeth look longer, persistent bad breath, and in more advanced cases, loose teeth or changes in your bite. The most critical takeaway here was that gum disease, particularly in its earlier stages, is often entirely painless. Waiting for pain to signal a problem is often waiting too long. This underscores the absolute necessity of regular dental checkups for early detection and intervention. Now, knowing all this, understanding the mechanisms, the shared risks, the warning signs, what does it mean for you personally as you navigate your health journey in your senior years? It might feel like adding another concern to your list, another thing to be vigilant about. But I genuinely hope you see it differently. I hope you see this knowledge not as a burden, but as a profound source of empowerment. It offers a shift in perspective. Caring for your mouth is no longer just about preventing cavities, having fresh breath, or maintaining a pleasant smile. Although those are certainly wonderful benefits, it's about actively participating in the protection of your cardiovascular health. It's about recognizing that simple daily habits performed in front of your bathroom mirror are, in fact, contributing to the health of your heart and blood vessels. It elevates oral hygiene from a routine task to a fundamental pillar of preventive health care. Think about the long-term implications. Consistent, effective oral care throughout your life, and especially now, is an investment. It's an investment in potentially reducing your risk profile for serious cardiovascular events. It's an investment in maintaining your ability to chew comfortably and enjoy nutritious foods, which further supports overall health. It's an investment in preserving your natural teeth, which contributes to confidence and social well-being. It's an investment in reducing the potential need for complex and costly dental treatments down the road. And by potentially lowering systemic inflammation, good oral hygiene might even have benefits reaching beyond the heart. As research explores links between gum disease and conditions like diabetes management, respiratory illnesses, and even cognitive function. Seeing oral care through this wider lens helps us appreciate its true significance. It's about nurturing the interconnectedness of your body, understanding that caring diligently for one part invariably supports the health of the whole. So let's translate this understanding into concrete, positive action. What can you actively do to nurture your oral health and, by extension, support your heart? The good news is that the core principles are straightforward and largely within your control. First and foremost is effective plaque removal, every single day. This means brushing thoroughly, twice a day. Use a soft bristled toothbrush, manual or electric. Many find electric brushes offer superior cleaning with less effort. And fluoride toothpaste. Spend at least 2 minutes each time, ensuring you gently clean all surfaces of each tooth, outer, inner, and chewing surfaces. Pay special attention to the gum line, angling the bristles slightly towards the gums, and using gentle, circular motions. Brushing isn't just about removing food particles, it's about physically disrupting that sticky bacterial film, plaque, before it hardens into tartar or causes inflammation. Cleaning between your teeth daily. This is absolutely critical and non-negotiable for gum health. Your toothbrush simply cannot reach the spaces between your teeth and just below the gum line, where plaque and bacteria love to hide. Traditional floss is effective if used correctly, curving it around each tooth in a C shape and sliding gently below the gum line. However, many people find flossing difficult due to dexterity issues or tight spaces. Don't give up. Explore other options like interdental brushes, tiny brushes designed to fit between teeth, available in various sizes. Dental picks or water flossers, devices that use a pulsating stream of water. Find the tool or combination of tools that works best for you and commit to using it every day. If your gums bleed initially when you start flossing or using interdental cleaners, don't be discouraged. It's often a sign that inflammation is present, and consistent cleaning will usually help it resolve within a week or two. If bleeding persists, definitely mention it to your dentist. Beyond daily cleaning, regular professional dental care is essential. Schedule routine checkups and cleanings. For most adults, this means every 6 months, but your dentist will recommend the frequency that's best for your individual situation, especially if you have existing gum disease or other risk factors like diabetes. These visits aren't just about polishing your teeth. Your dentist and hygienist will perform a thorough examination, looking for early signs of gum disease, including measuring the depth of those gum pockets we discussed, checking for cavities, screening for oral cancer, and assessing the overall health of your mouth. Professional cleanings, scaling, and polishing. The hygienist will remove hardened plaque, tartar, or calculus that you cannot remove yourself with brushing and flossing. Removing tartar is crucial because it harbors bacteria and irritates the gums. Don't hesitate to discuss concerns. If you have anxieties about dental visits, fear, cost, discomfort, please talk openly with your dental office. Many dentists are experienced in helping anxious patients feel more comfortable, offering options ranging from simple reassurance to sedation dentistry. Discuss payment plans or insurance coverage up front if cost is a barrier. Remember, preventive care is almost always less invasive and less expensive than treating advanced problems. Your dental team is your partner in maintaining your oral health. And let's not forget the supportive lifestyle factors we discussed. If you smoke, quitting is one of the single best things you can do for both your oral and cardiovascular health. Seek support if needed. Resources are available. If you have diabetes, strive for excellent blood sugar control through diet, exercise, medication as prescribed, and regular monitoring. Choose a balanced, nutrient-rich diet, limiting sugary drinks and snacks that feed harmful oral bacteria and negatively impact overall health. Find healthy ways to manage stress, whether through exercise, hobbies, mindfulness, or social connection. It truly is never too late to make improvements, even if you've neglected your oral hygiene in the past, or if you already have some degree of gum disease. Taking consistent action now can make a significant difference. Gingivitis is often completely reversible with improved home care and professional cleaning. While the bone loss from periodontitis isn't reversible, treatments can effectively halt the disease's progression, reduce inflammation, control infection, and help you keep your teeth for much longer, significantly lowering the associated systemic inflammatory burden. Your body has a remarkable capacity for healing when given the right support. Embrace the power you have through your daily choices and your partnership with your dental professionals. Taking care of your teeth and gums is not a chore. It's an act of profound self-care. It's a tangible way you can exert positive influence over your long-term health and vitality. Every time you brush thoroughly, every time you diligently clean between your teeth, every time you keep your dental appointment, you are taking a step not only towards a healthier smile, but also towards a healthier heart. So, let this be our final thought. Cherish your smile, not just for its appearance, but for its deep connection to your overall well-being. Nurture it daily, attend to it professionally, and know that in doing so, you are honoring the intricate, wonderful system that is your body, and investing wisely in the health of your heart for all the years ahead.